Welcome back to Coach's Corner. Today we have Christen Kinsella, our newest dietitian, and she's a dietitian who was also my preceptor when I was a baby dietitian.
I always forget that too.
I know. It's so fun. So let's start off with Christen. Just tell me like 2 things about you that you want people to know.
2 things about me. Ooh. Do you want random things?
Yeah. Random. The more random, the better.
Okay. I've been on a weird amount of game shows.
I totally forgot about that. How many game shows have you been on?
So I was on the first episode of Wipeout. The one. This is random fun facts about me.
Yes.
And it will all make sense the more you get to know me. I was on the first episode of Wipeout.
Okay.
I was on Family Feud. That was also a fun one with Steve Harvey.
Mm-hmm.
And then I was on Price is Right. But I didn't get called down, so that was sad. But they put me in the front row, so I was the girl everyone hugged when they won.
You're the best person to be that girl, actually.
I was that girl. So I didn't win anything, but I was on the TV a lot.
Do you have any other game shows coming up in your near future?
No, I wish. I really wish.
I mean,
maybe, I know.
You can do it again.
Yeah.
The world's your oyster.
It really is.
Okay, so Kristen's been on a lot of game shows, 3 to be exact, and maybe more in the future. We're not sure.
I also was in a final. I was top 30 of another one that me and my friend tried out for, but it never aired. So
what was that one?
It was about a restaurant. We made a restaurant called Bitesies, where we wanted.
Okay.
Where we wanted to just have a restaurant where you could try all the food. Because I don't want just like one thing. I want to try everyone's things. So it was like different bites. That was our idea.
So you submitted this proposal to do it, but you didn't actually like do it or film it?
No, because I don't think that it was a good show, so it didn't air.
I mean, I would watch that show or just participate.
Exactly.
That would be great.
I know.
Okay, so one fun fact, lots of game shows. Give me one other weird one.
Well, a lot of people don't know that I'm from Georgia. So I'm a Southern girl. I love sweet tea, and I love college football.
You do. She loves college football, and I never know what she's talking about, but I try.
I do love college football. So yeah, I'm a Southern girl.
Okay, question about being Southern. Yeah, in Flagstaff. Did you go to Cotillion?
Yeah. Well, it was called Promenade. Ours was called Promenade. And I will never, ever, I'm so glad you asked me this. I'll never forget. Because I am very tall. When you meet me, I'm very tall. So as a 5th grader in Cotillion, or Promenade was what, they use them interchangeably. You have to learn dances. And I would always get put with my friend, Adam Protos. Love you, Adam. But he was very, very short. So we would always get put together, and I always felt bad for him. And I was like, I was taller than most people, so I was used to it. But then I was like, maybe not put me with him.
Maybe not this vast difference between the height spectrum.
Yeah, but he's a very good friend, and it's all fine. But
okay.
And when I look back on it, I'm like, I'm actually glad I was put with him because we laughed a lot. But yes, but that's why I know. Yeah, I definitely know like where my forks are, and
wow. I mean, it's a good. It's a ridiculous skill.
Yeah, it's ridiculous.
It's like a really dumb skill to have, but in the very rare instance that you're in that occasion, it's probably helpful.
Yeah, maybe.
I don't know. There's sometimes just way too many things on the table.
Yeah.
It's really necessary. So
there is. But yes, I did.
Okay. So game shows from Georgia. Went to Cotillion. Loves football.
Yeah.
Okay. There we go. There's the fun facts.
Some fun facts.
And you have been a dietitian for way longer than me, so tell me how long that's been.
Okay, so I was trying to remember this. I'm not good at fast math.
No.
Okay, so I graduated my internship in 2006.
Okay.
But then I worked, so I don't know, 15 years maybe?
Okay. Yeah, that's fair. I like that face. Like,
is
15,
that right?
Maybe.
Because I did dietetics and I worked with my dad's company a little bit.
Mm-hmm.
So I was out of it for a few years and then came back. So I was kind of, but actually even when I was working with my dad's company, I still worked.
You were still a dietitian.
Yeah, well, and I still worked. I did like different health screenings for people.
Yeah, like employee wellness stuff, right?
Yeah.
Okay. Yeah, I mean, I honestly probably couldn't answer that question. I think I'm like maybe 8-9 years, but I still just don't know these things.
Right.
It doesn't
Fast
really matter.
math. I don't even know what year it is. 2024.
2024.
Got it.
Now, yeah, and it's gonna be 2025 soon. So buckle up. Glad we're wrapping our brains around it. And so, especially like, tell me a little bit about your path of even being like, I'm gonna go be a dietitian, because I didn't know that was an option when I was younger. So tell me your
so
story.
neither did I. I'm so glad to hear that. I didn't either, but I'll tell you. Well, and honestly, started way back. So my sister, who's 2 years younger than me, when she was in 5th grade, so that makes you 10 maybe, 10 or 11.
Yeah.
She was diagnosed with ulcerative colitis, bleeding very bad. And in 5th grade, GI doctor wanted to take her colon out, and my mom, wanted a second opinion, because that's a lot for a tiny human. Yeah, for a tiny human. So I'll never forget, she found a doctor that just focused more on nutrition. And at that point, I mean, this was 30 years ago, so a lot of that, it wasn't, there were dietitians, but I didn't know about them. And there were doctors with nutrition, but I didn't know about it. But this one, I watched him, and of course she had to take medication too, because
ulcerative colitis.
Yes, it's ulcerative colitis. You need medication, but I also watched how food really affected her disease, and by knowing what affected her, and we watched her symptoms like really subside, and she just turned 40, and she still has her colon, and
I love this. Still has her colon. Great.
And so that was my first experience of like, wow, food like makes a difference. Like as far as, I just didn't know anything. I just ate food, and you eat food, and as a kid, that's what you do. It's just
right. It just is what it is.
But that was the first thing where I was like, wow, this affected a disease in my sister, and I watched her, get better too.
Yeah.
Which is really cool. And still to this day, she again on medication too. Medication is important.
Yes, totally. Yes.
But that was my first inkling of like, oh wow, there's like a nutrition space, in medicine too, like in the medical field. So that was the first time I saw it. And then growing up, I was always an athlete, played a lot of sports, and I had my brother and I both like struggled with like IBS and different gastro things, and I just got to the point where I was like, I don't want to eat breakfast because it hurts my stomach, and I don't want. And then I'm at basketball practice after school, and I'm wrecked, and I'm getting injuries. And then I was like, there's got to be a better way.
Maybe I shouldn't feel this way all the time.
Maybe I shouldn't feel this way, but I just didn't know, know. And then you have your parents who, I have wonderful parents, but they're of the generation of like diet culture. I mean, it's still here, still a thing. But the low fat, all that stuff at that point. The Weight Watchers was really big, all that kind of thing. So, Slim Fast, that was a big thing then too. So I just watched so many people just not understand food, and I wanted to understand. And so then, but again, still didn't know a dietitian was a thing. So I'll never forget. I went to, I always thought I was going to do I wanted to do something with like sports. I was thinking like physical therapy and that kind of thing. And then I went to a college like orientation, and I met with two of the dietetics professors who are both dietitians. And they talked to me about the profession. I was like, this is a thing? This is amazing. This is what I want.
Like, how has no one told me this is the choice?
Yeah. So literally that is why. And then I was like, this is awesome. This is what I want to do. Because you learn about the body, you learn about medicine, but then we have to eat every single day. Multiple times a day. And as a person, I don't like not understanding things. So I wanted to understand how food worked in my body. So.
Yeah. That's super cool. Yeah. And I would be interested, like, just even like peering other polling other dietitian friends, like now I think it's a little different, like people know it's an option. Totally. But I feel like definitely of our generation, it was just like kind of fell into our laps of like, oh this was not right.
Is that what happened to you too?
Totally. Yeah, it was like not right in my life, and then I was like, oh, oh, this is a choice.
Right.
Yeah. Oh, cool.
I know. It's crazy. It's crazy that it wasn't more known, but yeah. It's really great.
Yeah. And so even thinking about that, like, so we met working clinically. Tell me a little bit and explain maybe, because I think people don't understand, like, okay, let's talk about this. What's a dietitian versus nutritionist?
Ooh, this is my favorite question. So now we actually do call ourselves Registered Dietitian Nutritionist, a lot of people, because there was so much confusion. But nutritionist, anyone can call themselves a nutritionist. So you go to GNC, you go to wherever, anyone can call themselves a nutritionist. There's no governing body. Yeah,
Probably nutritionist.
Nutritionist. There's no governing body, so there's no education requirements. There's no requirements at all. So as a dietitian, have to have a 4-year degree. Now you have to have a master's. Didn't always have to, but you have to have a master's now. Have to do a dietetic internship, which is anywhere from some are like 2 years.
Yeah, it's 1,200 hours.
Yeah.
So whether you get that done in 8 months or
2 years.
Longer than that.
And then you have to do continuing education. You have to do continuing education to keep your license. Oh, and you have to take a test that's very hard.
Yeah, you have to take a national exam.
Yeah.
That's really challenging, and not everybody passes.
No,
and
more people than you realize don't pass.
Yeah. That was probably the most stress sweat I've ever experienced in my life. I was hitting out. It was extreme. And okay, so that is dietitian versus nutritionist. Tell me a little bit about what it looks like on a day-to-day basis to be a clinical dietitian, because you've been a clinical dietitian for probably, 10?
Well, I mean, honestly, clinical dietitian, I started doing it, it's been about 10 years. I was out of it when I had my baby a little bit.
We're definitely going to talk about him, too.
So, yes. And about 9 years. And it's funny because I never wanted to be a clinical dietitian. In school, I was always like, this is not what I want to do. I don't want to be a clinical dietitian. That wasn't what I wanted to be an outpatient. I wanted to work with people that, came to see me and that I could have more relationship with, and maybe athletes. Like, these are the people I wanted to work with. I didn't think about working in a hospital. And then when we moved to Flagstaff the first time, my husband was working in the hospital, and it just turned out they had a job, and I was like, okay, well, I'll try it. And I ended up really, really loving it. Really loving it. I mean, there's so much. I think I underestimated the impact that you can have. I think I underestimated that, and just how much I would learn. I mean, I'm constantly learning. There's not a day where I'm like, know everything.
That was boring.
Yeah.
Right. That was boring. I learned nothing today.
Every single day I'm like, never heard that before.
Yeah.
So that's really cool for me. So so as a clinical dietitian, the main things we're doing, the biggest thing right now, diagnosing malnutrition. That's a big thing. So we're diagnosing malnutrition in a hospital because when we diagnose, insurance actually will reimburse for that. So that's pretty cool. And then interventions for malnutrition, because malnutrition, especially in the hospital setting, really tied to, worst cases of mortality and that kind of thing.
Yeah, mortality, longer hospital stays, more infections, more risk.
All of it.
Readmission, all the things.
Yes.
Yeah, so this is also why weight loss is not always inherently good.
Nope.
Or really, is it?
No.
Yeah, ever. Hard to say.
Yeah.
So huge aspect of malnutrition. And then tell me what else.
So then other thing, if you're in the ICU, it's mostly going to be nutrition support. So we're doing tube feedings, we're doing TPNs. So the tube feedings are, you're feeding in a tube that's going, a PEG tube can be right in your stomach, or mostly in the hospital you're doing an NG tube, which goes through your nose down to your stomach. So feeding people that are intubated, that can't, or post-surgical, that they can't eat and meet their needs yet. And then TPN is parental nutrition, which is in an IV, in a central line, a PICC line, and then giving their nutrition that their gut can't handle it for whatever reason. So we're doing that, and that's something that always scared me in school. I was like, I don't know that, and that it's my favorite part. I mean,
it's so fun.
It's
so mathy.
It is, which I always thought to myself, oh, you're not good at math, you shouldn't do that. And then I'm like, no,
I mean, that's also a lot of cultural conditioning around women, especially in STEM and things like that.
Right.
For sure. And I think, and even thinking about TPN, it's like, it's not, we're not putting like in an enteral nutrition, whether it's a nasogastric or oral gastric tube, like we're putting kind of like not a milkshake, but it looks kind of like that in it. But we're not doing that in veins. It's like everything is broken down so your body can just absorb it. So it doesn't have to go through any of like the enzymatic or digestion processes in your gastrointestinal tract. Yeah. And it is life-saving.
It is.
For a lot of people.
Oh, totally. And like the earlier you're getting nutrition support, the better the outcomes are. Yeah. For sure. And then, so on the regular floors, we're doing a lot of nutrition education, post-surgical things, post-cardiac surgery, GI surgeries, a lot of diabetes educations. A lot of new people come in the hospital because they, are in diabetic ketoacidosis and they don't know they have diabetes, and so a lot of new diabetics that way too.
And also wounds.
Wounds,
wild thing. This is like another topic, yeah. But I mean, Brian, one of our physical therapists, and even Taylor, they both worked clinically. Taylor still works clinically in the ED right now. But wound care is a huge thing that physical therapists can be a part of that team, and also dietitians are. And so there's, I think, a lot of cool crossovers there of like, we don't do wound care at Evolve, which is great.
But nutritionally, we can help you.
Nutritionally, we can help you heal, for sure. And so I think it's really neat how I think the hospital also gives you a really beautiful glimpse of what an interdisciplinary team looks like.
That was my next point.
Yeah.
Yes, 1,000%. Working with others, learning from others, knowing how important an interdisciplinary team is to patient care, and communicating with that team.
Totally. And I think, granted, in the United States, our acute healthcare system is bomber. It's really good. Everyone works really well together.
We can keep you alive.
We can keep you alive. We are so good at that. Yeah. Granted, it typically ends up falling apart a little bit once we get into an outpatient setting. And I think that's a little bit about why we created Evolve to be the way that it was, so that we could have an interdisciplinary team under the same roof. Yeah. And so our interdisciplinary team, we don't have like a pulmonologist on our team or something like that because we don't need it, but we have physical therapy, we have acupuncture, we have whole group of amazing strength coaches, and then dietitians. And so we get to collaborate in that sense. And then we also have John, who's a psychologist, who's also one of our strength coaches. So we get to have this really nice approach in that sense, that I think is something that is really missing in a lot of outpatient settings.
Well, and that it would be my biggest, that's why also I want to do outpatient, because in the clinical setting, you don't get any follow-up.
Yeah.
So you never know the end of the story. And I like to know. I want to see the progress, and I want to be there to help. So that's a big reason that I appreciate outpatient, and for the fact that you get more one-on-one time, because in the hospital you have a lot of patients to see. So maybe you're spending 15 minutes talking to somebody, but you're not getting that connection with patients that I thrive off of, honestly, as far as connecting with people. So. I want to know what happens, and you don't get to see that in clinical, so that's the downside of it, for sure.
Yeah.
They get to leave, so that's exciting.
They get to leave, which is good. We want them to leave.
Definitely want them to leave, but sometimes I'm like, well, what happened?
Yeah. And I think that's, even when we look at, Evolve and all of that, and I want to ask like a little bit of, what inspired you, outside of me basically begging you to move back here and work with me? What was, outside of the story, like what really excites you about being in an outpatient setting?
Without a doubt, connection with people.
Yeah.
I mean, that is one thing that I thrive off of. Like, I learned in the pandemic, I do not do well alone. And I think I probably already knew that. But that kind of highlighted it for me, and I want to know people. I want to connect people. I want to be vulnerable. I want people to roll. I love that.
Yeah.
I love it, and I love it. And I have a knowledge and skill set that can help people. And so I would love to be able to use that, even if it's just one person. I know that sounds super cheesy, and like, if I could just help one person, but I do feel like that is what brings me joy, like knowing that something I know that someone else maybe didn't know that could be helpful to them. That's really exciting.
Yeah, and I think that it can, help them kind of have that scope that like, oh, food in these ways, like maybe the way I'm thinking about it isn't the healthiest, or the way that I'm going about it isn't the best for my mental and physical and emotional health. And like this can have a huge impact on chronic disease and other things. And it's like that, and just being able to walk with people through it.
Walk with people and help them get rid of the noise too, because there's so much noise. I get on social media for 10 minutes and I'm angry with them.
Social media is real.
Because I'm like, there's these snippets, right? There's these snippets. So people get these big headlines, like never eat, the one I saw the other day was like, never eat cereal. It's terrible for you. Never, and it's just like so much nuance, so much thing. And so like being able to maybe help someone like get rid of that, that noise, and help them, wade through the waters of diet culture and social media and these things that are just giving us so much information, is we're having information overload, and it's hard to know what is true and what's not.
Yeah.
So.
Yeah, and I think we don't realize how much we go through the world, and we actually end up just, we're not even actively trying to learn things, but on social media or even in like friend communication, it's like we're constantly absorbing. And so we're not intentionally learning, but we're absorbing, which then we often it takes 10 times longer to unlearn the thing that you absorb without intentionally absorbing it.
Yes, that's so true. I didn't think about the unlearning, but yeah, it's hard.
Oh yeah, I feel like
even me, because I have knowledge, and I can kind of differentiate in a lot of ways, but still sometimes I'm like, is that true?
Yeah, totally. Oh yeah. It's really, I think it's really fascinating. That's like the beautiful part of outpatient, because you can spend time. You can have that 30-minute conversation, going around all the ins and outs of that, and being really curious with people. Like, where'd you first learn this from? Like, how does that make you feel? And like, we get to have those conversations
and know where it came from. That's something in clinical too. Like, I don't know your background. I don't know why all of this happened. We're just trying to fix it, and I want to know why it happened so we can work on that too. Totally.
Yeah, and tell me a little bit. So, you're a mom now.
I am a mom.
And he's very cute. His name is Rivers.
Yeah.
And I feel, this is my perception, and I've never actually asked you this before, but I remember at least going into clinical, when I was working with you clinically, like we would get lunch at the cafeteria, and it was like free, and it was great, and it was a huge perk. But I also remember being like, at this point, like a lot of dietitians are real weird about their food, or can be, not all y'all.
Agreed.
But I remember even just like, it seemed to me that you had so much freedom in that, and I think that's always been really cool. And so I always have had the image, I'm like, you've just always had like a really balanced and neutral relationship to food. And maybe tell me a little bit about like, has becoming a mom shifted that at all?
That's such a good question. First of all, being a mom is wild.
Yeah, totally.
So yes, I do. I am very thankful. I grew up in a house where, I didn't. Eating was. We love eating. We loved food, and food was food. And my mom wasn't really worried. Like, I remember I would come home and I would eat Gushers, and and it was just like, food is food, and it was delicious, and I wanted that as a kid, right?
Yeah.
And so I never had those food is good and bad. I was always pretty neutral. That I'm very, very thankful for that. That being said, you get pregnant, and suddenly I'm in charge of this person growing inside me. So now I am not obsessed, but definitely more cognizant of what I'm putting in my body, for sure. Because it's like no alcohol, like
Well, there's definitely safety things you can't.
Yes. But then I'm just like, okay, do I have enough folate? Do I have enough vitamin D? Like all of these things that are in my head. So honestly, it got a little worse with that in pregnancy, because I was very worried. I was an anxious, I was older, and I had more anxiety about that, and it took us a while to be able to get pregnant. So the fact that I wanted to make sure I did everything right. And I'm kind of a perfectionist that way too. So I'm like, I will have the perfect pregnancy.
It's going to be perfect.
It's going to be perfect.
Right.
And guess what? My baby was still in the NICU, and I did all the things, and, there's...
Life is life.
Life is life. And so that I was not in control of that.
Mm-hmm.
Anyway, So that happens. I'm pregnant. I have the baby. And then I'm in charge of feeding the baby. So now I'm so worried about my milk production. So I'm doing everything I can to make sure that I'm drinking enough, I'm eating the right things, and I'm having to do that, right? So again, I forget about me at this point. You know, it's not about me. And even during pregnancy, it wasn't really about me. It was how I was nourishing this baby. And then, again, I have to nourish. I have to have enough breast milk, you know? So I have to eat all the things that are going to make this right, you know? Because I was anxious about that. He's in the NICU. So then there's that. We get through that. And then they start solids.
And then there's solids. And that's, yeah.
And then my relationship with food was, I was so worried, because, you know, sometimes you know too much, too, you know?
Oh, dietitians, we know way too much.
We know too much, right? And especially with, like, food and preventing picky eating. And here's the thing, you can do all the things right, and your kid will still be picky. Like, it's not your fault.
Right, kids are gonna be kids.
They're gonna be kids. And so I was always worried about that. I wanted to make sure, you know, he was getting enough fat, he was getting enough iron, was he eating vitamin C foods with iron? I would tell my sister that. My sister was like, what are you talking about? She has 2 kids. And my sister-in-law, who also has 3 kids. What are you talking about? No one's ever told me that you need to eat vitamin C with iron. And I was like, yeah, I guess nobody knows that and all their kids are fine.
You're like, it's cool. What you're doing is cool. Yeah. You just keep doing what you're doing. It seems like it's working out well.
But again, knowing too much, like I want to absorb iron, so I need vitamin C. So very paranoid about that. To the point where I'm like, it was stressful. Like, food was stressful. First of all, feeding your kids is hard, no matter what. Feeding yourself can be hard. So now you're having to feed another child, another being.
I'm walking out the room, maybe crawling. But.
Right, and I'm in charge. You know, I'm in charge of what goes into this body. Like, he doesn't have a choice over that. So that was stressful to me. And honestly, that was like, it's so funny because most people, you know, I think depending on, as a dietitian, it makes sense that I was most paranoid about that. Because I remember I was in therapy one time and our therapist was like, it's really interesting that you worry about food. And she was like, no, but that makes sense because I worry about my kids' mental health a lot.
Right, totally. It's like whatever we are very professionals at, it's like, you know, you just see things everywhere and that's where your brain goes. Because
totally.
That's where you spend so much time and energy.
Well, and also I had a baby in 2020. So then I was alone for 2 years. So all I had time to do was worry about what he was eating and his health, you know?
Totally.
And so that was hard. So then on the other side of that, so my relationship with food, then I would just get very angry because I'm like, I have to feed this kid all the time. What if I mess it up? And then realizing that he grows, like all the things happen. And honestly, I didn't have any control over that. You know what I mean? Like, people that don't know about iron and vitamin C, their babies still have fine iron.
Right. They're okay.
All of them are okay. So I had to go through that and see it on the other side that he is growing. And then now we're in a season of, like, family meals are my favorite. Do I love cooking all the time? No.
Right. Then there's that.
Feeding children is still hard because they eat all the time. So, and during that season where I was so worried about him, I forgot about me.
Right.
So I would, and it's not that I was trying not to eat, but I would just eat his leftovers. And then it's 2 o'clock in the afternoon. I'm like, why am I so tired? And my husband is like, what did you eat for lunch today? And I'm like,
I forgot
to eat lunch. Like, I just literally, and that's not like me. I love food. And I was like, I just forgot, you know? And so I really had to be intentional about planning things and, like, it's not enough to just eat your leftovers.
Right. All the little bits.
Yeah, I have to have food for myself to be a better mother. Because I am for sure a better mother, person, partner, everything when I'm fed.
I think we all are.
We all are. But why it takes not doing it to realize that?
And I think it's really challenging. Again, it was like, okay, so new mom, kid had, like, Rivers was in the NICU for a little bit. Then you moved. And so,
COVID.
Like, and I think also it's like, you know, like the way that anxiety manifests in our bodies, it's like, it's control. And it's like so much fear. And so what that does from even like a physiological standpoint is it often shuts down our hunger cues. And so it's like, again, not intentional that you're like, I love food. It's interesting, but like, I'm tired, I'm isolated, I'm now not getting, like, normal hunger cues, because, like, oh my gosh, what if you fall off something and I'm gonna freak out? Like, oh my gosh, what if you get COVID?
Please
like,
take a nap!
Like, so many things that it's like, it totally makes sense, and I find that so many parents that I work with, like, that is what happens. And like it is, I would say, you know, there's this aspect where it's like you kind of become like more in the backseat of what your focus is on.
Yes, absolutely.
And I think a lot of parents get really frustrated with that, you know, where it's like trying to fight with this, like, okay, I had a lot of autonomy over my life, now I don't, and and I'm like, this is a chapter, and how do we best take care of you through this
chapter? It is a chapter, and I will tell you on the other side, family meals are my favorite.
Yeah.
And you know, it took work to get there.
Yeah.
But you know, that's one of our favorite parts of the day is all sitting around. That's when, you know, he's telling us the most, making jokes, trying new foods, you know, and I love, you know, we really try to, you know, just make food and watching him enjoy food.
Yeah.
And you know, just it's great. So
Yeah.
on the other side of it's great. It's still hard to feed kids. There's still hard in it for sure. But I don't have the anxiety about it anymore.
Yeah.
Which is great. And part of that was probably just a time in my life, like the pandemic was hard.
It was extreme. It was extreme for everyone. I think
hard.
we're still not even able to wrap our brains around like what happened to us, what is still happening to us.
Yes.
Yeah.
Totally. So now I think and I'm more, you know, he goes to school now, so I have time to eat breakfast and lunch.
Yeah.
Yeah. So they're all parents who have little ones. There's another. You're gonna come out the other side. Everything is a season. But
season, chapter. It's a page.
But don't forget to take care of yourself.
Yeah.
It's important.
Yeah. Well, thank you so much, and we are so excited that you're on board. We are so excited that our team is growing, and it's so fun that I get to work with like one of my best friends. It's so great.
I literally just love. I told Abby, I was like, can we just talk?
Can we just do this? I know. And what would be like, I guess, just like one last thing, even one sentence, which is real challenging, would be, you know, like what would you hope for someone to gain through working with you?
Ooh. What would I hope for someone to gain working with me? I would hope that they find joy in health, movement, and food. I want people to just feel joy in all of that because it can be stressful, it can be hard, and but these things, we're so blessed if you have the opportunity to have food, to have movement, to have your health. What a gift. Right? What a gift. So I think it's hard to, when you're in that and you're trying to do all these things and you're a parent or you're a student or, you know, or you're just trying to live your life, it's kind of hard to find joy in those things. And I hope people can find joy. Yeah.
I love it. Well, thanks for joining Coach's Corner. You will be around a lot. And you'll be seeing a lot more of Christen, which is great. And
come see me.
Yeah. And thanks you all for tuning in. If you have any questions, thoughts, throw some in the comments, and we are excited. Have a great day.